Hello and good afternoon. I am Dr. Pradipta Bhattacharya. I am a senior consultant and in charge of the critical care unit here at Neotia Getwel Multispecialty Hospital. And today we would be discussing a bit about introduction to the critical care unit or the intensive care unit here at the Neotia Multispecialty Hospital. So critical care unit is basically a specialized ward in the hospital which deals with very sick patients.
Wave beats music.
The patients which come into the critical care unit are having serious life-threatening problems such as a cardiac problem like a heart attack or a heart failure or serious life-threatening arrhythmias, neurological problems like coma or pre-coma state or convulsions which are continuing for a long period of time. Then there could be patients with septicemia and multi-organ dysfunction. Then we also deal with patients with very severe form of trauma who are on life supports, and sometimes we deal with patients who are coming with old age related problems like dyselectrolytemia and will come in a very drowsy state and with some form of underlying infection. So the main challenges of these patients are that they are on some form of organ support. Now, organ supports can be in the form of hemodynamic support. They could be on some form of respiratory support. It could be an invasive ventilation system or a non-invasive ventilation system. The invasive ventilation system connects the patient with the ventilator through a tube which goes into the patient's airway and through the vocal cords, and the patient is kept under some form of sedation so that they do not feel the distress of having the tube or their oxygen providing tube into their airway. And then there could be some form of kidney support which are in the form of dialysis or different modes of dialysis like the SLED dialysis or the CRRT, which are advanced form of dialysis. And these also occur in patients who are on ventilators, and they can also be on dialysis at the same point of time because they could have both respiratory failure and kidney failure at the same time, but they need to be on dialysis in the ICU itself. So the ICU in the Neotia Getwel Multispecialty Hospital is divided into 3 or 4 units, like the medical ICU, which deals with mostly medical patients, the surgical ICU, which mostly deals with neurosurgical and post major surgery patients, and also a multispecialty ICU which deals with different kinds of patients. We also have a cardiac ICU which deals with mainly patients with cardiac ailments or post angioplasty patients, and also the cardiac ICU would have some post coronary bypass surgery patients also. So to deal with such kind of serious patients, we have to face a lot of challenges. Like the patient themselves are very sick and mostly in an unstable condition with multiple organ failures or impending organ failures. Also, we have to deal with the anxious relatives who are there trying to know about the condition of their patient all the time and expecting that they would get better in a few days. So for this we have a team of around 25 doctors which comprises of 3 consultants at this time, full-time ICU consultants. Then there are post-MD registrars who have done their primary specialty in medicine or anesthesiology or pulmonology and are practicing intensive care or learning intensive care at the same time. And there are some senior medical officers who have been associated with the intensive care unit for a very long time. So this multi-specialty unit actually deals with all kinds of patients, including the cardiac patients, the sepsis patients, the renal failure patients, the neurological patients, the neurosurgical patients, the trauma patients, and try to put up a very great team effort so that these patients come out of a very serious life-threatening condition and can head back home.
Wave beats music.
When a patient comes into the ICU, they are in a very unstable condition. The first part of the job is to stabilize the patient, and at many times these patients have to be put on a respiratory support or the ventilator. Now, many people think that ventilation is the end of life. It's not, because many of our patients, around 60 to 70% of the patients, will come out of the ventilator and will go back home. So ventilator is a support system which sustains life during a crisis period when we try to improve the patient, involving a multi-specialty team of doctors, by some specialty medicines. And after that, when the patient starts improving and the organ support start getting decreased, then we take them out of the ventilator support and we will put on some oxygen support so that they can continue their medical journey. And after these patients come out of the organ support, they are actually shifted out of the primary ICU, and then they are shifted to step down ICU or the high dependency unit, where they are observed for 2 to 3 days so that they have a continuous improvement. And if they have a continuous improvement in that unit, like in the step down ICU, then they are moved to the general ward or cabins when they are out of all kinds of supports and they do not need monitors. So the monitors in the ICU are specialized equipments which will monitor the heartbeat, the blood pressure, and the temperature and the oxygen parameters of the body in a very specific way. From time to time, they will give us updates regarding what is the if there is any change in the condition, or even they will give alarms if there is any serious problem. So with the help of these monitors, we get to know in an early state where we should be intervening along with the medicines, where is there any other intervention required for the betterment of the patient. So coming to the ICU nursing, it's a very important aspect, and most of the times when we come to the wards of the hospital, we find that one nurse is generally serving 4 to 5 patients, catering to 4 to 5 or even more patients. But in the ICU, there are specialized nurses who are trained in the intensive care, and they provide nursing to one patient, mostly one patient, or at max 2 patients, because in the ICU these nursing will be allocated to 1 or 2 patients only. If the patient is on ventilator, we provide 1:1 nursing, which is the standard way to do all around the world in standard big hospitals, and that is the amount of care that is needed for these kind of patients. And the specialized nursing, I mean to say, is the main backbone of the monitoring part, along with the equipments of a critically ill patient. Along with that, we have specialized doctors round the clock for these sick patients, and they would be there for one doctor for at least 5 or one doctor for 6 patients would be present at all times in this critical care units, and they would be catering to the different needs of the patient as well as cater to the needs of the nursing which is looking after the patient. During visiting the patients, the most important aspect is to have a good hand hygiene before touching the patient. If we are touching the patient, we could actually transfer some infection from our hands which would not actually affect us, but they could affect a critically ill patient. So performance of hand hygiene with the bedside, this hand wash is of utmost importance before touching the patient, and it is best if we refrain from touching the patients in their very critical condition. And we have to have a very low voice in the ICU, because we could understand that all the patients are in a sick condition and they would be disturbed if we are speaking in a very loud voice. That is the type of environment we try to follow in the critical care units. And after all, there are counseling sessions for the patient relatives by the ICU doctors, and they could also meet the ICU consultants from time to time whenever they are required. Through the ICU coordinators would actually help them to visit the doctors who are taking care of the patient, and in this way, through a multi-specialty team effort, the patients could actually get better and come out of a very crisis situation. So briefly, I tried to mention about what functions this ICU serves in a hospital. It's a very important part of the hospital, and this is involved in the most difficult times of when a patient comes into the hospital. After they become better, we always like to have to see the smiling faces of the patients. So hoping that this session was helpful regarding the understanding of the functioning of the critical care unit, mainly at the Neotia Getwel Hospital. And I would like to sign off. Here is Dr. Pradipta Bhattacharya. Would love to meet you again. Thanks.